All right. Okay, so I'll introduce myself first to get started. My name is Amelia Marcus. I'm a health policy analyst at the Maryland Health Benefit Exchange on the policy and plan management team. And I'm really looking forward to working with everyone here and facilitating these work group meetings. For today's agenda, we'll start by giving time for everyone to introduce themselves, work group members. We also have quite a few MHB staff who've joined the call today, so they can introduce themselves quickly as well. And then I will give an overview just generally of the exchange, our health plan offerings, and then go into an overview of the work group itself, work group scope, and expected outcomes from work group members. And then the final agenda piece for presentation-wise, we're joined by Hilltop today, who will present a great overview. They did a literature review of marketplace plan shopping. So it'll provide some great context for consideration for a lot of our work group discussions. So they'll be giving a presentation on that today too. And then we'll conclude with some time for an initial work group discussion, just to open kind of next steps, initial thoughts before we conclude at 1:45 today. So getting started, we're here because the exchange we're always working to improve how we provide support to consumers during plan shopping, particularly through our consumer platform, the Maryland Health Connection. We do regular consumer user experience testing every couple years. We're constantly conducting user surveys. But in addition to all this work, we're interested in convening a larger work group with stakeholders, external stakeholders as well, you all, in a work group setting to provide broader and just a more diverse perspective on strategies, best practices that could be implemented in Maryland to help advance the needs of consumers, particularly Marylanders who use the Maryland Health Connection platform to enroll in health plans. So again, thank you all for joining. On the next slide, we have a list of work group members. I want to make sure and give everyone a chance to introduce themselves. We've reserved the first 20 or so minutes of this meeting. I'm going to go through the names in order. If everyone could take maybe 30 seconds to share your name, your affiliation, and or your experience with the exchange, working with the exchange, as well as your interest in joining this work group. I'll note quickly that there's two members who have expressed interest in co-chairing, Shlomo Rosenstein and Robin Elliott, who I believe are both here. If you both could also share a sentence or two about your interest in co-chairing along with your introduction, that'd be great. And then if there are any others who would like to express interest in co-chairing the work group, please feel free to do so in your introduction, or you're welcome to follow up with me after this meeting. So I'll call everyone's name in order. I will start with Lisa Barrows, if you're here.
Hi, yes. So my name is Lisa Barrows. I've been at, I work at Care First. I've been there for almost a year now, and I work there as a marketing strategist within our commercial business division. I do specifically work with the individual under 65 and small group segments, which is how I am familiar with the exchange. But yeah, just wanted to work in this work stream as a way to kind of give back and help out in whatever way I can.
Thank you, Lisa.
Amelia, this is Michelle. It might be helpful when people introduce themselves if they're able to put their camera on so we can meet who they are.
Yes, I agree. If you're able, at least when you're introducing, please feel free to put your camera on. That'd be great. Next, we have Kara Chang. Kara, are you here? Not hearing Kara, so I'll move on to Stephen Doman.
Hey everyone, Steve Doman. I'm one of the product managers for United Healthcare. This OEP will be my fourth OEP, so looking forward to providing insight where I can. I'm one of the product managers for our ACA acquisition sites. So nice to meet everyone.
Thanks, Steve. Next, we have Shelly Eldridge, who I know is not able to make this first meeting, so we'll make sure she can introduce herself at the next meeting. After Shelly, we have Robin Elliott, who is also interested in co-chairing. Robin?
So hello, everyone. I know some of you, but not all of you. So Robin Elliott, I'm a policy consultant, also do some lobbying in Annapolis, and represent and work with a lot of different groups, but expressed interest specifically on dental because of really the desire to increase the number of adults who are purchasing dental coverage. One of the reasons I've volunteered to co-chair is I've had some experiences with the exchange and wonderful staff and other stakeholders in the past. I was co-chair of the Standing Advisory Committee for probably longer than my term. And then recently participated in a similar group looking at how to make reproductive health coverage information more accessible to consumers. So I'm happy to volunteer, but also very happy if others are interested.
Great. Thank you so much, Robin. Next, we have Ruth Gedichu. I apologize if I butchered your last name, but Ruth, if you're here.
Hi, yeah, and you didn't. That's exactly how you say it. So my name is Ruth Gedichu. I'm here with the Maryland Insurance Administration. I'm their Director for Consumer Health Coverage Assistance. We have and continue to work hand in hand with the Maryland Health Benefit Exchange because we do a lot of the consumer interactions, right? So anybody that needs assistance enrolling, we do connect them with various individuals at the Maryland Health Connection, but also doing general education. So one of the presentations that we currently are holding more regularly is how to use your health insurance. So Jenny Garrison comes in and she talks about how to enroll, and then we talk about how to use it once you have it. So my interest is because I've had such a really good working relationship with MHBE, but also because my department is housed within the Consumer Education and Advocacy Unit. So we're very focused on ensuring that we are providing information in a way that's accessible and current, accurate, all of those things, but making sure that people are utilizing the information that we're providing. So very excited for this group and what's to come.
Great. Thank you, Ruth, and welcome. Next, we have Erica Halsey. We'll give Erica a minute if she hasn't joined yet. Moving to the next person, Thomas Hamill. Thomas, are you here? Stephanie Clapper. Stephanie, are you here?
Yes, hi, Stephanie Clapper, Deputy Director at Maryland Citizens Health Initiative. We represent consumers and our mission is quality, affordable healthcare for all Marylanders. And I've served on various MHBE committees in the past and work groups, and I'm a big fan of MHBE. So excited to be here.
Thanks, Stephanie. Welcome. Next, we have Carmen Larson. Carmen?
Okay, hi. My name is Carmen Ortiz Larson. I'm the president of Hispanic Chamber of Commerce for Montgomery County. Also, I wear multiple hats. So that is one that I'm really representing here, the interests of the minority community and the small business community. I have other things that I do is I co-host the annual Minority Legislative Breakfast. So I work with the African American and Asian American groups to develop policy priorities for minority communities. But I also am familiar with the exchange because I was involved from the very early days. My other hat is a technology and IT company We participated with the early days with IBM and the not to be named Meridian, and then subsequent with QSSI and Deloitte in building the website and and getting the navigator trainers for the navigator out. So I'm very familiar with the policy behind it and the history of it, and very interested in making sure that there's inclusion and that small businesses are also represented, not just the minority communities, but also because many of the people in minority communities are entrepreneurs, making sure that they're represented as well. Thank you.
Thank you, Carmen. Thanks. Next we have Allison Mangiaracino from Kaiser. Allison, are you here?
Yes. Hi, Amelia. Good afternoon, everyone. My name is Allison Mangiaracino, and I'm the Exchange Policy and Operations Manager for Kaiser Permanente. And I'm serving on this work group with my colleague, Erica Halsey from our sales systems team. We're just really looking forward to participating and really think this is an excellent effort by the Exchange to look at how the enrollment application and plans are displayed and seeking ways to make things more consumer friendly and understandable. So thank you. I really appreciate the effort.
Thanks, Allison. Welcome. Next we have Ariana Meehan.
Hi, everybody. Ariana Meehan, Aetna. I am the Regional Sales Director for Individual and Family Plans. I manage several states for individual and family plans, some other state-based exchange states. I'm also on this work group with another member from Aetna, Tom Hamill. He's in our product team. So really just, although I primarily work with the broker distribution channel, really interested in understanding the consumer experience and how we can improve it for the Marylanders. So thank you for having me.
Thanks, Ariana. Next we have Joan Painter. I don't think Joan's with us yet, so we'll move to Shlomo Rosenstein right here.
Hi, Amelia. Hi, everyone. My name is Shlomo Rosenstein, and I'm a financial advisor with Prudential. And I also wear a second hat that I am a top broker with the Maryland Health Connection. I work with individuals as well as a small group, both in terms of the W-2 and the entrepreneurial world. I really have a lot of experience working. I was first introduced through the BAT phone program. So that really gave me an introduction to a lot of the diverse people within the state of Maryland. And I was able to leverage all of those referrals and connections to really scale my relationships with many, many home and households within the state of Maryland. I am very interested in joining this group as I have my MBA from Johns Hopkins Business School. And I did a lot of consulting and team group working together, and I'm really excited to give back and to meet many of the stakeholders and give back in any way I can.
Thanks, Shlomo. And to confirm, you're interested in co-chairing the work group as well?
Yes.
Thank you. Next, we have Seth Savensky-Potma. Seth, are you here?
Yeah, Seth's having some technical difficulties, but he'll be on later calls. But Seth works directly with Maryland individuals, so he'll be a great asset for us, I believe.
Great. Thank you, Steve. Appreciate it. And last, we have Lisa Skipper. I don't see Lisa as well. Okay. It looks like Kara's not able to.
Hello?
Oh, hi, Lisa. Is that you?
Yeah.
Hey, Lisa.
Yeah, I got disconnected from the computer, so I called in on my phones.
Okay, great. Well,
Sorry
floor is
about that.
yours. No worries.
So I work at Mountain Laurel Medical Center, which is an FQHC up in Garrett County, Maryland. I am a navigator with the Maryland Health Connection, and I assist the consumers with their enrollments in the far west region. I previously served as a member on the Standing Advisory Committee for several years. And my main purpose in being on this is to be a voice for the consumers that I assist.
Great. Thank you, Lisa. Thank you, everyone. If you haven't been able to introduce yourself yet as a work group member, please feel free to do so. I think we missed a couple. Give anyone a second to speak up. Okay. Otherwise, we do have quite a few MHBE staff on the call, so I'll try to go through the list in order as well. And if everyone could just quickly say their name and title. But I will go ahead and start with Michelle Eberle, if you'd like to introduce yourself first.
Thanks, Amelia. Michelle Eberle, Executive Director for the Exchange. And Amelia, thank you for pulling this group together. I think we have a wonderful group of volunteers who have stepped up to the plate. And as you all know, our mission is to make sure everyone in this state has affordable quality health coverage. And so we are always striving to get those last folks uninsured, and anything that we can do to make the process easier and more meaningful is going to help us achieve our mission. So we greatly appreciate the expertise you each are bringing to the table, and thank you for helping us achieve our mission.
Thank you, Michelle. I see Tony Guzman.
Yes, good afternoon, everybody. My name is Anthony Guzman. I am the Special Projects Manager here at the Exchange. And just as Michelle said, I can only echo her sentiments. I really look forward to assisting this work group in providing any kind of, feedback, suggestions, recommendations as a huge advocate of health literacy and health education for the consumers to help simplify the process and help getting people enrolled a little bit easier. Anything that I can provide, I can definitely assist with.
I see Dinesh.
Yep. Good afternoon, everyone. This is Dinesh here. I'm the UX UI architect. So whatever this group's come up with, I'll take that to IT and implement it as part of the digital channel. Looking forward to it.
Elvina.
Hi, I'm Elvina Morris. I'm the IT director here at Maryland Health Benefit Exchange. I work closely with business operations teams on consumer escalations, as well as any operational concerns that we get from the consumers. And as Dinesh said, any feedback that we receive from this group, we would want to implement in our systems. So we'll be part of it. Thank you.
Thank you, Elvina. I see Johanna's joined the call.
Hi, I am Johanna Fabian Marks, and I am crashing. I'm actually on maternity leave at the moment with my 2-month-old Sophia here, but we're excited to listen in. So, thanks, everybody.
Johanna, it's nice to see you.
And Sophia, too.
And Sophia. Nicole.
Good afternoon, everyone. My name is Nicole Edge, and wait a minute. I thought I had that up. Okay. My name is Nicole Edge. I'm the program manager in our plan management department, and along with being charged with certifying plans each year, working with the carriers just on an overall partnership. Also very interested in hearing what this group comes up with as far as plans are concerned, and literacy and more understanding for consumers and more support for consumers around selecting a plan. So that's always something that we are very interested in plan management as well. So happy to be here. Thank you.
Thanks, Nicole. And there's a couple of comments in the chat. There's some advice for newborns and health coverage. So thanks so much for the initial comments. All right, so just moving on, very quick housekeeping. We will vote on co-chairs after this meeting. I will send an online survey out that you can fill out. It'll also include a vote to approve the workgroup charter. So I sent out the draft workgroup charter along with all the meeting materials last week. So look out for a survey after this. It'll have the co-chair vote and the work group charter vote, but I'll also touch base on that at the end of this meeting. So getting started, I'll give a hopefully quick overview of MHBE and the exchange health plans. So MHBE 101, the Maryland Health Benefit Exchange is Maryland's private health insurance marketplace. We were launched in accordance with the 2010 Affordable Care Act. Our main function is administering the Maryland Health Connection, which is the marketplace online platform where residents can shop for and enroll in health plans, compare rates, and determine eligibility for public assistance all in one place, all in one platform. And MHC includes our consumer website as well as the mobile app and our consumer assistance call center. In Maryland, we also have an integrated enrollment system with our Medicaid program in our Maryland Department of Health. So in addition to private marketplace plans, Maryland Health Connection also processes the majority of Medicaid eligibility and enrollment too. So in total, with both marketplace and Medicaid enrollees, we serve almost a quarter of Maryland residents. As of June of this year, we had over 215,000 individuals enrolled in private marketplace plans through MHC, which is our highest enrollment to date, which is great. And then we had a little over 1.2 million individuals enrolled in Medicaid through Maryland Health Connection. Maryland Health Connection is the only place where individuals enrolling in private plans can access financial assistance. So we have our federal subsidies as well as state premium assistance. The federal subsidies available to consumers are the Applied Premium Tax Credit, APTC, which reduces monthly premiums for eligible consumers to no more than 8.5% of a consumer's annual income. And then there's also cost sharing reductions or CSRs, which are additional subsidies that reduce out-of-pocket costs like copays, deductibles for a plan. Consumers up to 250% of the federal poverty level are eligible for CSRs in addition to APTC. And you can only access CSRs as an eligible consumer if you enroll in a silver plan, which I'll touch on a little bit, but I think most everyone here is familiar with. And then Maryland also has our state subsidy program, our young adult subsidies program, which launched in 2022. It's a 4-year pilot program that provides state-funded premium assistance in addition to all the federal subsidies, APTC, for premium assistance. Qualifying young adults are eligible for these additional state subsidies, and they further reduce their premiums in addition to the federal subsidies on a sliding scale, with the youngest and the lowest income eligible young adults receiving more generous state subsidies. And the parameters for this program are set annually by the exchange, by our board, and are currently available to qualifying young adults age 18 to 37 and up to 400% of the federal poverty level. MHB's scope also includes numerous other enrollment activities and other program administration. So we oversee our Navigator program, which is a statewide network of partner organizations who deliver outreach, education, and general support to consumers statewide. We set plan certification standards, which we use to establish certain features that we want to ensure are included in all plans sold on the exchange, or certain information making sure is available to consumers for all plans. We also administer affordability programs. So we talked about the young adult subsidy program. We also administer a reinsurance program, which I've included a link to in this slide. If anyone's interested in more information on the reinsurance program, it's not as relevant to these work groups, but there's a link there in case anyone wants to read more about it. And then lastly, we are responsible for enhancing our Maryland Health Connection enrollment platform to make it easier for applicants to enroll in health plans. So that will be the main focus of these work group discussions. This slide is just it shows the specific statutory language for the purpose of the exchange. So again, our overarching purpose is to reduce the number of uninsured residents in Maryland, facilitate the purchase of qualified health plans on exchange, and then assist individuals in accessing public programs and financial assistance as just described. So a quick overview of 2024 Maryland Health Connection plan offerings. We currently have 4 on-exchange carriers in the individual market. Aetna just joined the individual market this year in 2024. So they're joining CareFirst, Kaiser Permanente, and United Healthcare. This 2024 plan year, among those 4 on-exchange carriers, there are 44 plan offerings in total available to consumers. Not every plan is offered in every county. However, all consumers have at a minimum 30 plans that are available to them. The 44 plans total offered this year is up from 2022, which had 33 plan offerings, and 2023, which had 35 plan offerings in total. And then the table on the right breaks down our plan offerings by carrier and metal level. So just as a quick overview, I think, again, most people are familiar, but just to level set, there are plan categories. There's 4 main metal level plans. Goes from bronze, silver, gold, all the way up to platinum. There's also catastrophic plans that are available to those under 30, or in some cases, people with certain exemptions. But mostly it's the 4 main bronze, silver, gold, platinum. The metal levels indicate the generosity of the plan in terms of cost sharing that's split between the plan and the consumer. So starting with bronze plans, which are the least generous plans, they have lower premiums, but they have higher cost sharing for the consumers, like higher deductibles, higher coinsurance. And they're generally better choices for consumers that have lower healthcare needs. And then moving up all the way to gold and platinum plans, which have the highest monthly premiums, but the plans are more generous, so they cover more of the cost sharing, so consumers pay less out of pocket for their care. The higher metal level plans are generally better choices for consumer that have higher healthcare needs, so individuals managing chronic conditions or needing regular routine care, or have multiple prescriptions that they need filled monthly are some examples of individuals who might want to choose higher metal level, higher value plans. Consumers can apply if they're eligible for federal financial assistance, they can apply their APTC to any plan at any metal level. But for individuals that are also eligible for cost sharing reductions, those additional CSRs, they must enroll in a silver plan in order to receive those additional CSR subsidies. And just quickly, some other considerations in addition to metal level for consumers to consider when plan shopping. Other major considerations for plans include checking whether specific services, providers, prescriptions, etc., are covered under that plan. So that's a quick overview of our MHC plans and plan offerings this year. I'll go through really quickly the last thing too. For our plan offerings, the MHBE requires all carriers to offer now what we've termed value plans, which are plans with standardized cost sharing determined by MHBE, which just means that for any given metal level, the same service under a value plan must have the same copay across all carriers, so they're standardized copays. And the overarching goal of value plans are to improve healthcare access, improve affordability for consumers, promote insurer competition, and I think most importantly for the consumer, simplify the plan shopping experience. So part of the benefit of offering value plans is they allow for a more apples to apples comparison of plans with their standardized plan designs, because cost sharing doesn't vary by plan. So consumers can more easily pick a plan based on maybe which carrier they like or the plan's network. And then all value plans include the word value in their plan name, so consumers can see the value plans when plan shopping. And carriers must offer one value plan at each of the bronze, silver, and gold medal levels. So we've had value plans available on the marketplace for a couple years. And that is a quick intro to MHBE, quick intro into our plan offerings. Moving along, I am going to give a quick overview now of the work group specifically and expectations for the work group outcomes. But before that, just want to pause for a second and see if anyone has any initial questions. Feel free to use the hand raise option. I'll do my best to check the chat, but if I'm not getting to a comment that you'd like to address, please feel free to share it. Yes, Robin.
So I'm guessing we might get into this later, but just wanted for just starting off purposes, does the exchange have metrics or a way of tracking a consumer's experience, either through purchasing insurance on the web or through navigators? Like, for instance, how many times do they stop and start the process? And no detail now needed, just wondering if that data exists.
That's a great question. And yes, it does exist. There's other departments that will be able to address that question. I know we have a few members from our marketing team who are either on this call or will be joining later calls. I know we've done quite a few analyses on that of use of our consumer websites and kind of analyzing the process of where consumers get, where they're stopped. So yes, I think we'll be incorporating some of that information into a future work group meeting, but that's a great question. And we'll be sure to include some of that information. All right. Seeing no further questions, I will go ahead and just get into an overview of the work group. I'm trying to do this. Shlomo, go ahead.
Sorry, just you mentioned on the requirements on the value plans that each carrier is, I guess, required to offer a value plan. I'm sure we're going to get into this later on, but specifically on networks and PPOs versus HMOs, I just find that like specifically Care First seems to be one of the only carriers to offer outside of Maryland's coverage. Is that like something that is a requirement, or it's just a case by case, decision?
I'm not sure if someone else in this call is better able to address that question, but feel free to speak up if you are. And then I'm wondering if maybe Care First would be able to address that as well.
Amelia, this might be something to pen for a different discussion because there's a lot of legislation around it, offering the PPO product and requirements of nonprofit health insurance companies. So it might be too long of something to discuss for this particular date and time.
Thanks, Michelle. Yeah, Shlomo, I can follow up with you a little more if I can maybe provide some offline information if you're interested.
Yeah, sure.
Could I add to that? Okay. To that, while you're thinking about all that, one of the things that happens is, especially here in where we are in the DMV area, people sometimes they go outside, out to another state. So are any of these plans, I guess it's a following question for later on, but are any of these plans able to cover somebody who gets sick someplace else? If they're in a different state? I don't know.
From a carrier perspective, Aetna's plans cover emergency services out of state. I think that's pretty standard with all of our individual and family plans, and also our individual and family plans outside of Maryland. So all of our plans only include in-service areas, so only in-state providers are covered. And I think it has to do with how you file, right?
Right. Oh, okay. So it's in the emergency case they can handle it, but if if somebody were to be 6 months up here, 6 months there, they would have a rough time. They'd have to be traveling back.
Right.
Yeah.
It's true emergency services are covered out by the state.
Okay.
Thanks, Carmen, for the question. Thanks, Ariana, for the information. It actually is I mean, it's a subject that we could table for a later work group discussion if that's something that may be important to display in plans or make sure that consumers understand, or, you know, making sure that information is accessible if it's something that's deemed important by this work group.
And I just want to throw that in the Hispanic community, a lot of times people go to their home country and they don't have insurance there. And the question always comes up, and I say, no, you don't have insurance. If you go out there, you have to go buy special insurance. So, but that, yeah, those questions come up. Thanks.
Thanks, Carmen. No, it's a great point. Thank you. All right, I'm going to try to breeze through the work group overview. I want to make sure we get to a great presentation by Hilltop, so I'll try to be quick here, but want to make sure I cover everything. So quick background on why we're here. MHBE is always focused on initiatives to further reduce our uninsured rate in Maryland, but of equal importance, and that, you know, we consider a priority topic, is addressing the adequacy of coverage under our health plans that are certified and sold on exchange, and the adequacy of plans that consumers choose to enroll in, and providing support, you know, how we offer support to consumers when they're choosing a plan. We know that a lot of marketplace consumers struggle to choose a plan that best fits their health and financial needs. We know that there's varying gaps in health literacy, just understanding all the insurance concepts. It's a convoluted field, and especially choice overload with the number of plans that are available on exchange to consumers. And one illustrative example of this, market research that was conducted last year, one of the survey responses showed that 1 in 5 young adults surveyed listed too difficult or confusing as at least one of the reasons why they previously had not received coverage or enrolled in coverage. Some other examples, we've had, you know, testimonial from consumers reaching out for assistance at various points throughout the years, asking about the option to switch their plan mid-year. So for example, a consumer enrolled in a bronze plan, but had recurrent medical needs and higher healthcare utilization and just didn't realize the impact of choosing a bronze plan on their out-of-pocket cost. So they reached out to MHC to see if they could switch to a higher value plan mid-year with lower cost sharing, but they're unfortunately unable to do so. And they're told that they have to wait until open enrollment of next year in order to choose a plan that's better suited for them. And then to highlight the issue a little further, in an analysis of enrollment data, we found that a significant number of consumers are likely not enrolled in the best value plan that they might be eligible for, considering all the federal and state subsidies available to them. So May 2023 enrollment data specifically showed that around 9,600 individuals were eligible for a higher value, free or nearly free silver cost sharing reduction plan. So consumers at or below 150% of the federal poverty level, but they were enrolled in another metal level like bronze or gold or even catastrophic plans. And this data also showed that over 16,000 consumers with incomes between 150 and 200% of the federal poverty level were enrolled in catastrophic bronze or gold plans, but they're CSR eligible, so they could pay slightly higher premiums for a higher value silver CSR plans. So we have the raw data if you're interested in looking through that more, but these are just kind of examples of data that show that maybe individuals aren't receiving the amount of information that they need in order to make the most informed plan selection. So getting to the work group purpose, there's a lot of research available on the subject of consumer support. And while the MHC platform already incorporates a lot of best practices, and we can go over them a little bit more, particularly in our consumer website, this analysis of our enrollment data, along with testimonials, along with some surveys, just highlights that we need further discussion on the subject. So the purpose of the work group and why we're here. We've convened this group of stakeholders to discuss areas to improve consumer decision support during the plan shopping experience within our MHC consumer plan shopping tool, which is our get an estimate tool. We call it our get an estimate tool, along with within the MHC application as well. So consumers use our plan shopping tool to get an estimate tool. They can input their eligibility information. They can check for available plans with that information provided, whether they qualify for financial assistance, and then they can shop for and compare plans all within the tool. And then ultimately, the work group will develop a set of recommendations for more effective decision-making support for consumers to better assist them with health plan selections that best fit their health and financial conditions. And I want to be clear too, for the scope of the work group discussions, we will be focused specifically on health insurance plan shopping in the individual market. So that's the work group purpose and scope. I'll go over expected outcomes really quickly. We kind of have three main focus areas that the exchange is interested in feedback on from this work group and to be discussed by the group for recommendations on how we can improve the consumer experience when plan shopping. So the first one are generally recommendations for identifying areas throughout the plan shopping experience and when using the Get an Estimate plan shopping tool where a consumer may benefit from more information or more guidance. So some examples might be looking through the current information that's displayed in our plan shopping tool and assessing whether it's presented clearly, maybe if more information should be presented to the consumer in certain areas, possibly identifying points in the plan shopping experience where a consumer may need a push in a different direction. So if someone input income information that shows that they're likely CSR eligible, guiding those consumers towards silver plans through maybe default plan sorting or filtering or something of that nature, just as some examples. Second focus area is recommendations for improving specifically the plan information display for each plan on the plan list page, as well as the side-by-side plan comparison layout within the consumer plan shopping pages. So some examples for consideration in this area might be, should we be more prominently displaying some information on the plan tiles? So these plan tiles right here. Are we highlighting things that we should be highlighting that the consumer would be most interested in? And then just generally looking into best practices on ensuring that the displays are consumer friendly, that we're providing consumers with the necessary information so that they can then make a good and informed plan choice. And lastly, the third area is recommendations for how Maryland Health Connection could ultimately provide tailored plan recommendations to consumers. So the example that I put in this slide, the Washington Exchange has a consumer plan shopping tool that's very similar to Maryland's Get an Estimate tool. However, it also highlights up to 3 what they call smart choice plans, which are plans recommended to the consumer based on the consumer information that they input into the tool. And they've implemented tailored plan recommendations for a few years now, and they will actually be joining at a later work group meeting to give an overview of their implementation of their smart choice plans, and will help for consideration for further discussion by this work group as we're discussing that. And then overall through the work group, we'll be incorporating available literature reviews on best practices and consumer decision support and reviews and comparisons of other state marketplaces, what their plan shopping tools look like, their layouts, their information display, and so forth, in order to help inform the discussions here. With that, I think we're just about on time. As I mentioned, we're joined by Hilltop, who on the request of the exchange conducted a literature review. They poured through articles that address topics of marketplace plan shopping and consumer decision aids. So they're going to provide an overview of their review, which will also provide more context on marketplace consumer plan shopping experience in general, along with major findings from their lit review and considerations for this work group. So I think maybe I'll hold questions for now and we'll go straight into Hilltop's lit review. So I will hand over the presentation. We're joined by Nick Nemec from Hilltop, and he's going to take it from here.
Thank you, Amelia. Yeah, good afternoon, everyone. My name is Nick Nemec, and I'm a senior policy specialist on the health reform team at the Hilltop Institute. Hilltop is a nonpartisan research organization at the University of Maryland, Baltimore County, and we specialize in research and data analytics to inform public policy. I've got a few other Hilltop colleagues here with me as well, Dolapo Fakaye, Tim Williams, and Jennifer Park. So let's go ahead and move into our discussion of the literature review. We'll have some time set aside at the end for questions. So we'll begin with the review of the scope of our review. So apologies, the number on the slide is a bit out of date. Our review actually returned 40 relevant sources, most of which were peer-reviewed journal articles. Some of the sources were surveys of the decision aids that different state, federal, and private health insurance marketplace sites are using. And many of them were experiments showing evidence for the effectiveness of certain types of decision aids. Next slide, please. So the first major theme among the sources we reviewed was that many of them characterized and presented evidence for different sources of difficulty that consumers face when choosing the plan that will serve them best financially. We found several sources that identified issues with consumers' numeracy, meaning their understandings of numerical concepts and their ability to work with numbers, as well as their understandings of insurance concepts. And as Amelia described, there's also evidence of choice overload, which is a challenge where a large set of choices overwhelms consumers, and they choose poorly or feel unable to make a choice at all. And you'll see in that last bullet that making no choice at all was a trend that some researchers observed more generally across previous studies. Similarly, there was a bias towards choosing the default option. Next slide, please. The sources we reviewed also highlighted that certain groups face unique challenges when shopping for insurance plans, and these needs are important to consider when making choices for plan shopping architecture. Prior Medicaid enrollees, those with low levels of health insurance literacy, and uninsured individuals were most likely to face shopping challenges. And one study found that facing multiple shopping challenges was associated with difficulties finding a doctor, understanding your coverage, and getting assistance. Another important result, one study found that for a cancer patient on expensive therapy, metal tier and stated annual out-of-pocket maximums were actually unreliable indicators of financial protection. This underscores the need for decision aids that help consumers to look beyond these metrics and understand the plans being offered more deeply. And more generally, decision support features must be tailored to the individual so that they account for the unique types of needs that we've discussed. I want to note here that the expected level of healthcare usage tool that's available in Maryland Health Connection is a great example of this type of dynamic decision aid. And near the end of the presentation, I'll be noting many of the existing features of Maryland Health Connection for which we found evidence of their effectiveness in our lit review. Next slide, please. Many of the sources provided evidence for the efficacy of certain types of decision aids. Several sources studied the effectiveness of providing consumers with a smart default plan or multiple plan recommendations based on the consumer's expected healthcare costs. One source noted that consumer-oriented organizations have recommended filling the first page of plans that an enrollee views with exclusively plans that are the best fit for that enrollee. And two sources presented experiments demonstrating the effectiveness of smart defaults and plan recommendations for increasing the chances a consumer will choose a plan that maximizes coverage and minimizes cost. A 2018 review of state marketplace websites found that some state marketplaces use plan recommendations or even show exclusively recommended plans, based on the information a user provides about themselves. Next slide, please. So a related category of decision aids has to do with the assessment and the use of a given consumer's personal preferences for what they look for in a plan. One of the sources we reviewed describes this as another area that consumer-oriented organizations have made recommendations in. Specifically, they've recommended that exchanges highlight the plan attributes that evidence shows consumers tend to care about, which include cost and whether certain physicians are in network. A recommendation noted in multiple sources is that exchanges could gather consumers' personal preferences for what they want from their insurance plan. This information should be gathered through easy-to-answer questions and can be used to tailor the plan choices that are displayed. Additionally, one source found that some private insurance marketplaces use a different strategy. They label plans with flags such as best match or cheap plans, which then allow consumers to make choices based on what they value in a plan. Next slide, please. Plan partitioning is another feature supported by the evidence we reviewed. This refers to highlighting certain plans by separating them from other plans visually. This was highlighted as one of the unique features available on some marketplace sites. We reviewed an experiment demonstrating that plan partitioning can improve plan choice by focusing consumers' attention on higher quality options. However, for the feature to work that way, the plans that are listed first and partitioned off must be the optimal plans. Otherwise, partitioning can limit the amount of searching that consumers undertake and limit their discovery of the best options for them. The marketplace website reviews that we looked at also identified some potential innovations for how marketplaces can communicate information on health plan networks. One opportunity for innovation is to communicate network information for each plan directly inside of the marketplace, rather than linking to a health plan's external website. And going even further, some marketplace sites allow enrollees to sort and filter plans based on whether plans cover a specific physician or hospital. The authors of one source noted this as a best practice and the ideal way for consumers to be able to interact with plan network information. They noted, though, that the network information would have to be kept up to date to be helpful. A couple of other unique features used by some marketplace sites include a visible metric indicating network size for a given plan, and a map showing the in-network providers for a plan. Next slide, please. So digital decision support tools were another category of decision aid featured in the literature. We reviewed studies testing a few specific decision support tools, whose outcomes included better health insurance knowledge and confidence in choosing a plan. Notably, one tool that was reported on simulates likely usage and cost under a range of outcomes using demographic data, user responses regarding expected medical expenses, and analysis of public government data and corporate data. Another major category of changes that were recommended and/or tested centered around consumer education. One source found evidence across previous studies that displaying graphical depictions of probability, risk, and total estimated cost may help fill gaps in consumers' understanding of these concepts. Tools to help consumers understand plan pricing were also recommended. Additionally, there were several areas where it was recommended that information be made front and center to ensure enrollees understand. These areas included the fact that primary preventive care must be covered at no additional cost under all plans, the penalties and exemptions under the Affordable Care Act coverage mandate, an explanation of the adult dental insurance marketplace, and a clear explanation of the affordability provisions available for consumers who qualify, such as cost-sharing reductions. Next slide, please. Other recommendations and evidence-backed strategies included the following. One review of past studies found evidence that using symbols rather than numbers to represent price and quality ratings aided consumers in their interpretation of these metrics. That same review recommended providing out-of-pocket cost estimates for several possible outcomes, such as a typical usage scenario and a worst-case scenario, rather than just for one. 2 studies found improvements in plan choices when prompts, also known as nudges, were used to remind consumers to use all decision support tools at their disposal and to consider total estimated costs. Finally, multiple sources reflected feedback from consumers and stakeholders, indicating that narratives about health insurance situations and how others have made their plan choices would be helpful on exchanges. The narratives, or vignettes, should be tailored to the consumer, and it was recommended that exchanges consider other modes of communicating the narratives beyond just written to avoid overwhelming consumers with low levels of literacy. Next slide, please. Our literature review also found evidence that many marketplace features that Maryland Health Connection already has in place are effective at increasing consumers' likelihood of choosing the best plan for them and improving plan satisfaction. We saw evidence for the effectiveness of providing plan quality ratings, giving consumers tools to sort and filter plans, allowing for side-by-side comparison of plans, automatically applying any subsidies for which the consumer is eligible to their premium and cost-sharing reduction estimates, providing definitions of health insurance terms that appear when consumers mouse over those terms, incorporating provider and drug directories, standardizing the plans that are offered, filtering low-income consumers to silver plans to guide them toward cost-sharing reductions, and providing total out-of-pocket cost estimates, as well as making it the default that plans are sorted by total cost. An important note on this last point is that we reviewed an experiment where participants were confused when giving out-of-pocket cost estimates without an explanation of the factors contributing to those estimates. So that is an important element for consideration when maximizing the utility of this feature for consumers. Next slide, please. Final slide. So that wraps up my summary of the findings of our literature review. I'd be happy to take any questions from the group now, but I'll defer to Amelia on whether there's an established protocol in place for calling on folks.
Thanks so much, Nick. That was a great overview and I think really helpful information for the work group. So very much appreciate you being here and appreciate everyone from Hilltop who contributed to this lit review. It's really excellent information. I think we'll go ahead and continue with the hand raise. So if anyone has any questions specifically for this Hilltop review, you can discuss it now. I see Carmen, you have your hand raised.
Yes. Okay. Just very quickly, in the literature review, what the source documents were from what year to what year roughly? What time frame?
I believe we reviewed sources from, I want to say the earliest was about 2009, but that was an outlier. And most were from 2015 on. The latest sources we reviewed were from 2024.
Okay, so were most of them from like 2015 to 2020 or something like that, or?
Yes, I would say so.
Yeah. Okay, so were most of them like pre-COVID? Yeah.
I'd have to look at our source list to be sure about what percentage of them were, but
yeah,
a decent portion were.
Okay, thanks.
And Nick, just maybe you could confirm, I think you said that you're comfortable with us sharing the full lit review with this work group. Is that okay to do?
Yes, yeah. So there's a full literature review document that we sent to MHBE that they can go ahead and share.
Yeah,
but I know that the sources are also in a appendix for these slides for this meeting.
Okay, are we sharing the slides?
Carmen, in the appendix of this slide deck, there's the references that Hilltop used for their lit review. So I'll reshare the slides after this meeting that have the references, and then we'll also share the full lit review that you all can look through as well.
Yeah, you already shared the slides, right, Sarah, for the things that you sent out beforehand?
Yes, yeah, okay. And I'll reshare them again.
All right, no problem. Thanks.
Steve, go ahead.
Hey, Nick and Amelia, I'd love to get a better understanding of the desired preferred channel of enrollment for residents of Maryland. Not sure if that was tackled in this study, but just taking a look at your site, I'm not seeing like a toll-free number. So I'm assuming that you guys would prefer just D2C online enrollments. And then when I clicked on Get Help, I do see you guys have a call center. So just curious on like the metrics of like what enrollment flows are just D2C online conversions versus your call center versus I see you've got navigator resources and then also like a link out to authorized insurance brokers. So curious on the desired enrollment method.
Yeah, great question. We have that information. We have monthly reports that we publish with a lot of enrollment data, and I believe it has some of that information in it. So I'll look through that and can maybe share more of that information afterwards as well as a follow-up. We'll also check in with our marketing department and see if we can confirm that. But that's a great question and can provide more of that.
Cool, thanks.
Allison?
Yeah, thank you for this review. I'm interested in slide 21 on the evidence for efficacy of specific types of decision aids. And I'd be curious maybe at a future meeting to dig in a bit on the smart default. Just what other marketplaces are doing. I know that there's some form of this with the Maryland Exchange shopping experience, and that there are questions up front about expected use of healthcare. But I think this slide is really interesting. The one, as I'm reviewing this on the final bullet, I would be hesitant to select a model where they're only showing the recommended plans based on user provided info. I think it makes sense to sort according to preferences, but I wouldn't want us to, exclude certain plans based on those recommendations. But I think overall, this slide is really interesting, and I would be curious to see what other marketplaces are doing. And then my second point is I'm just thinking about based on expected healthcare costs, and I'm wondering if there are smart default options out there where the kind of upfront questions ask about what's most important to the shopper rather than their expected healthcare costs. I mean, that's one variable in this. Someone might not be able to estimate what they expect to spend, but they could tell you, well, my monthly premium is most important to me, or the network is most important to me, or the cost of PCP visits is most important.
Yeah, thank you, Allison. I think that's going to be a great full topic of discussion, just thinking through consumer needs, the ranging variation in needs depending on healthcare utilization and specific health needs. And then I think to your point about the plan recommendations, again, I think it'll be great to have Washington join and they can walk through how they implemented their plan recommendations, their smart choice plans. From what I remember, if I'm remembering this correctly, they don't necessarily just filter out every single plan, but they do show their recommended plans first. So it is almost like a smart default combined with plan recommendations. But thanks for that input. I think it's important. Steve, do you have your hand raised again?
Yeah, related to that set of questions, I think on slide 22, maybe 23, there was a suggestion of, sorry, maybe 24, of symbols versus pricing. Nick, I don't know if you can speak to that. What type of symbols was the recommendation?
I actually cannot remember off the top of my head, so I can look into that and get back to the work group with that specific info.
Yeah, not sure if it was referencing like the star ratings or if there was something else, but I thought that was interesting.
I guess I do remember for the quality, it was star ratings. Yeah. Can't remember the exact indicator for pricing. I think it might have been like some kind of system like $1 sign, $2 signs, $3 signs. But I'll check and get back to the work group about that.
Thanks, Nick. And I think that's right. And we'll have quite a few examples from other states and how they display information. A lot of it is best practices and the graphical depictions versus just using plain language. So I think we'll get into that a little bit more too. And Allison, do you have your hand raised again? Allison and then Stephanie.
Yeah, regarding that last question, in our experience in Colorado specifically, they have a display of the quality rating that involves a fraction. So for example, instead of a graphical depiction of 3 out of 4 stars, it's 3-5. And, you know, what we know on numeracy is that that's more confusing than if you just display 3 stars. And so I definitely think that's something we want to keep in mind. And Maryland already has a really great display for the quality ratings, not only that graphical depiction, but then when you hover over it, you can see the sub ratings. So I think, you know, I just wanted to make that point that we have seen examples in other markets where there's a reliance on kind of numbers over symbols. And I think that does tend to be more confusing to consumers.
Thanks, Allison. Stephanie?
Thanks for this really informative presentation. I was just wondering if it might be possible to get a slide of decision aids supported by evidence reviewed that are not currently in use by Maryland Health Connection.
So
go ahead, Nick.
I was going to say I'll review with MHBE and we could probably make that happen.
Thank you.
All right, I'm not seeing any other hands raised. So I think we can end Hilltop's presentation. Thank you so much again, Nick. Thank you everyone from Hilltop. Really appreciate you putting this all together and presenting it to the work group. Really was great information. I think it'll provide a lot of context for our future discussions. So thank you so much. With that, we have 5 minutes left. I definitely want to make sure and respect everyone's time. So we'll use just a couple minutes. I think there have already been a lot of great feedback, a lot of discussion already just from the lit review that kind of feeds into some discussion questions that we had that we thought we would end with for this meeting. So if there's anyone that has any additional thoughts or questions, we have a few prompts that I'll give everyone a minute to read through, and I'll also read through them as well. In the last couple of minutes, if you have any thoughts on your work group member perspectives on what you see as major plan shopping consumer challenges when marketplace plan shopping, are there any other areas of focus that maybe we haven't touched on specifically today that you think would be important for this work group to discuss? And then just generally, are there any kind of final questions and considerations for this first meeting? Please feel free to use this time to share it. So I'll open the floor up for the last couple minutes. If anyone has any final thoughts or comments on any of these questions or anything else, please feel free to raise your hand or just say them.
Is there I'm sorry, Robin, go ahead.
Oh, no, go ahead, Carmen.
Okay, so excuse my ignorance, but because there may be something out there, but is there online tutorial or training on for a consumer who is interested in going in but is nervous about? I mean, I've had a number of people going in and then coming out and saying, oh, I didn't understand it, help me out. But I wondered if there was some tutorial out there that is like a YouTube tutorial. You know how you go to YouTube for anything that says how to go here, what to do when you get in here. Is there anything such thing like that? And is that available? And if there is it available in only English or Spanish?
Yeah, great question. We have a lot of video tutorials. Something that might be good to discuss is, are they accessible? Are they easy to find? Are they in the right places? Most of our video tutorials, I believe all of them, are both English and Spanish. So we always do English, Spanish. But that is something that would be of consideration, just generally going through the plan shopping process. Are people provided the information they need? Do we maybe need a tutorial that people can watch before they start shopping? Would that be helpful? I think that's a great question, and we could definitely spend some time looking into that more.
Thank you.
Thank you. And I think Robin next, and then Shlomo.
Sure. Just a question. I know we're almost at time, so maybe it's for future discussion, but I'm interested in discussing specifically people who are immigrants and how they access consumer information. I know that we are under federal guidance able now to add coverage for people here under DACA, and then hopefully we'll be implementing the qualified resident legislation from this past session. But I would imagine, in addition to information on the plan itself, there may be questions around the security of the information provided in the application, wanting to make sure that that's not shared beyond the exchange. So that's a topic that I'd be interested in exploring more.
Absolutely. I think that's a great point and noted very much. Shlomo, I'm not sure if you're...
Yeah, I just wanted to bounce an idea off of what Carmen just mentioned about accessibility in terms of, helping consumers find the assistance and the help that they need. And obviously there's a tremendous amount of support when it comes to the navigators and the helplines and the broker assistance portals. I just, and this is just from my experience, but I have a feeling that the website in general is kind of, from the technology perspective, is kind of a little bit weak and confusing. And it's very difficult for clients and consumers to navigate that on their own. There's a million ways that they could mess up on one button, and it really just either flags their account or it's not super easy. So if we could identify the specific, mean errors that clients and consumers come up with, and have like kind of, whether it's their tax information or their income or their, how they, add their family members to multiple different accounts, it could really, help with the confusion.
Yeah, I'll note that a lot of what you referenced is beyond the scope of this work group. So we're going to focus mainly on the plan shopping prior to kind of going through the actual application with, all the information as you're applying for and choosing a plan. But those are really great considerations. We do look into that, and I can also provide a little more information. Our marketing team does a lot with the actual application itself, making sure that when consumers are really going through the application, addressing confusion. We do a lot of work with that. For the scope of this work group, it's a little bit beyond that, but that is a great point. It's 1:46. I'm going to let Lisa have the final comment or question, and then we'll just close out really quickly with some next steps. Lisa, want to go ahead?
Yeah, thanks. So this is kind of hitting off of, piggybacking off of what Shlomo was just saying, where I would be very curious to know, when individuals are actually navigating through the website, are they typically using their mobile phone, which may not give them as much ability to kind of move around? And maybe is that why they're encountering some challenges? Or if they're using their computer, or just what type of device that they're using. If you have any metrics around that, I think that could be really great for our next conversation.
Sure. Yeah, we can provide that. We will try to keep these, again, just because the scope can get so broad, we'll probably keep it to the our portal, our computer portal, the accessing it through a computer versus the mobile site. I think we could have a whole other work group about the mobile app and user friendliness with that. But I'm happy to get more information on that. And, you know, also a great point. I think most people use their computer, but the mobile app is popular and is certainly another topic that we could spend a whole work group on. And then, thank you, Lisa. Then I'll just read Allison's comment for future discussion. 1, communicating the value of CSR and gold plans for shoppers that may select bronze. 2, should we look at ways to simplify the plan tile? Is it confusing to consumers? Perhaps includes too much information? Absolutely, I agree. And I think that we will more than likely address all those points. Thank you, Allison, for that. All right, thank you, everyone. I know we're a little over time, so I'll just give super quick overview of next steps. Again, we have 2 individuals who have stepped up to nominate themselves for co-chair. Thank you so much, Shlomo Rosenstein and Robin Elliott. Appreciate that. If there are any members who are interested in co-chairing, please feel free to share your interests. You can do so now really quickly, or if you prefer to follow up with me after the meeting, please feel free to do so. Otherwise, I will send out the survey right after this meeting. If you could look out for it, it'll have the question to vote for the 2 work group co-chairs, as well as the vote to approve the work group charter. So I will also reshare the charter. I'll reshare these slides, and I will share Hilltop's literature review with the group, and then we'll provide some follow-up based on questions in the next couple weeks, but hopefully before the next meeting. So again, please make sure to fill out the survey before the next meeting. Vote on co-chairs, vote on the work group charter. The next meeting will be held in 2 weeks from now, August 14th at 12:30. We may move around some future work group meetings to address some conflicts with other internal meetings, but generally speaking, we'll be hosting 7 meetings in total for this work group every other week, generally on Wednesday at 12:30. We have the tentative agenda set for the next meeting that you can read through. And then in terms of the rest of the work group schedule, just, you know, making sure everyone understands, we'll be having discussions on the topics of interest for this work group, providing a set of recommendations that we'll come to a consensus on. So the 6th meeting will have a draft report based on our work group conversations and discussion. The 7th meeting, we will vote to finalize the work group recommendations, and then MHBE staff will present the report and recommendations that come out of this work group to our MHBE Standing Advisory Committee for their considerations, as well as to our MHBE board for consideration as well. So we'll do that with our Standing Advisory Committee at their last regularly scheduled meeting this year, which is November 14th. So that's just a overview of the timeline and next steps for the work group. Are there any final questions before we wrap up? Any other comments? All right, well, thank you guys. Appreciate you staying on just a little longer. Hearing no other comments, I think we're good to conclude this first meeting. Thank you so much, everyone, for joining, and we will see you all in 2 weeks.
Thank you, Amelia.
Thanks, everyone. Have a great afternoon.
Thank you, everybody.
Thanks. Bye.